Okay, hello everybody. Well, welcome back. Today is not new shirt day, but for those of you who've been following along, you probably know normally I wear a new shirt when we're interviewing somebody, but today's interview is just a little bit different. Today we're interviewing the program director for a new hybrid PA program. So that's going to be an online didactic year followed by in person clinical rotations. This is somebody I've known for many, many years. We share a common specialty and just have been friends for many years. But I'm going to let him go ahead and talk about this new program that'll be starting. I believe they're going to be accepting applications in 2023, but he has a lot of great information about the program that's going to be starting up. He has a lot of experience in academia as well as a PA. But as I said, I'll go ahead and let him tell the rest of the story. Thanks. All right, well, welcome back, everybody. Today is a different type of interview. We're actually interviewing a program director for a new and upcoming PA program. I'm talking to Dr. Hlavin, and I've actually known Dr. Hlavin for many years. We both share a specialty in neurosurgery, but now he's going more academia. But I'm just going to go ahead and let him tell his story. So if you don't mind, I mean, I sort of introduced you already, but if you don't mind telling us your name and which program you're affiliated with now.
Sure. James, it's great to see you again. It's been a wonderful, long relationship and been way too long since we've had a chance to sit down and talk. So this has been quite a pleasure for me. I got into being a physician assistant through seeing a couple of PAs when I was in the military. And so I knew when I got out of the military, I wanted to do something not only in surgery, but something in this area of medicine where I wasn't going to move on to be a physician. That didn't really pique my interest, but at the same time, I wanted to advance my abilities in the operating room as well as in patient care. So the PA profession was the right fit for me. And it just so happened that when I came out of the Navy in 1989, there was a PA program available that I applied for and got in. In fact, I was waitlisted for one day. And then I thought, well, I'm going to have to reapply. And then the next day they called and said, oh, by the way, we've got a seat for you. So can you come on to orientation, which I did. And so from 1989 to 1991, I went to Cuyahoga Community College in Parma, Ohio, and got an associate's degree as a physician assistant. I did a surgical route during my clinical year. We kind of would split up into surgery or primary care, and I took surgery, of course, because that's where my love was. And had some incredible experiences during that, which changed the course of my career desires. And not to belabor my story, but just to say that I went to the Cleveland Clinic for most of my rotations. And when I went to and worked with the neurosurgeons there, the fellows and the residents and the the attendings, I had a unique opportunity to work with one attending who basically just handed me the knife and said, "Hey, take this shunt out of this infant." And I was like, "Well, I'm a PA student." He goes, "Well, that doesn't matter to me. Here's the knife. Here's where I want you to cut." And what that did is it changed the trajectory of my career, because I wanted to go into cardiovascular surgery. That was that's what I thought my love was. And I said, I'm not doing CV surgery now. I'm going to go into neurosurgery. And so that's where that's how I got started in this journey. And so I moved from Cleveland. I went to Oklahoma City and worked with a great group there. And of course, all neurosurgery, and then did a short stint up in Michigan, and then came down to Tulsa, Oklahoma, and then landed finally in College Station, Texas in 2005. And then at that point, I knew that I wanted to get into healthcare education. I wanted to be more than just a preceptor, although what a great job it is to be a preceptor, because you really have an opportunity to pass on this great history that we have as PAs, especially in surgery. And so I went ahead and moved forward with some degrees. I went from associates to a bachelor's to a master's, and then eventually my PhD, which I got through Texas A&M University, and then started trying to build a program at Texas A&M that didn't unfortunately go forward, but eventually with West Coast University here in the Richardson, Texas area. And then once they got their provisional accreditation, we decided there was a leadership change that was needed, and so that occurred. And then I've been looking for my next adventure until more recently, when I joined up with Franklin Pierce University out of New Hampshire, who has they already have a PA program well established there on ground, but now have started a hybrid program, an online program out Goodyear, Arizona. In fact, they just had their site visit successfully. And now they're branching into the Austin, Texas area, and they picked me up as the program director to begin that journey. And so I'm very grateful to them for this opportunity. And that's kind of the next iteration of my career. Now more of an educator and leader as opposed to a clinician. Mm-hmm. But I do miss my clinical days because I miss the engagements with patients. So hopefully that's a good, well-rounded look at my life, if you will, or my CV in a few words.
Well, actually, it's a really good explanation. One of the questions that commonly comes up, we ask our students at the interviews is, where do you see yourself in 20 years? And, this is a great example that you provided, certainly going from obviously all of your clinical career to now advancing to something else, such as being an educator and leader within the PA profession. So I know a lot of students are often stuck they're not thinking that far out, and not that they need to plan out, but it's nice to hear from other people who have transitioned or made that move. It's also interesting when you talked about your decision to pursue neurosurgery. I had similar when I was doing primary care, but I knew I wanted surgery, but I thought I was going to do orthopedics. And I was doing trauma when this guy I met in trauma just told me I should talk to this other neurosurgeon. He's hiring, you should meet him. And I just thought, no, I don't think I have that capacity, and it looked too hard. But I met with the neurosurgeon. He offered me just sort of like a trial position to see how I liked it. And within months, I realized I was never going to do anything ever again.
Mm-hmm. When you know.
You do. You really do. I mean, I found that, and I still just absolutely love. Mm-hmm. I've dabbled a little, like I've done some ortho. We did joint replacement, and oh God, no thanks.
Yeah. I don't know how it was when you were in the military, but we did so much primary care when I was on board a ship, and I did so much primary care and emergency medicine, and I had a good feel for the healthcare worlds that I didn't want to be involved in, but at the same time, how vital it was to have that knowledge and experiences, because basically all of my boards that I've taken, the first one, of course, we study our tails off to make sure that we do well in it. But then all those recertifications, I've passed those on. Of course, I've done some studying, but most of them come from my experience in the military. Because in neurosurgery, for 30 years, you're not going to have primary care medicine acumen. It's just not going to occur. So I really had to rely on my military experience, for those gut feelings around those questions.
Right. I told people, like you, I did most of my time on board ship. So I was on an aircraft carrier. I was on a amphibious ship. I did a LPD. I was on a frigate, and then my last ship was a destroyer. But
you did a lot more Navy than I did. I was on a subtender out of Polylock, Scotland for a while.
Oh, okay. Well, it was either just your basic routine run-of-the-mill primary care, or it was horrific trauma. It was never the in-between. So but so I guess, how did you come across this? I mean, I've known you for years. I know you've been involved in academia for many years, but how did you come across this new program?
I'd sent out several resumes back around October and November, and it's a bit of an interesting story. I interviewed at several PA programs, not only in Pennsylvania, but New York, but down in Mississippi and Ohio, also here in Texas, a couple that were looking for some leadership positions. And I've met these people like physically face to face. And when I talked with Franklin Pierce University back in November and had several interviews with them, all online like we're doing right now, and presented to them, and then just kind of lost touch. And I thought, well, maybe they move forward with another candidate. And it just so happens that the one university that I had never met physically face to face was the one that hired me. And so I think it speaks volumes to how we do things nowadays, maybe as a result of COVID, maybe just as a result of technology, and that we that I guess we can impress upon each other just as well in person as we can online. And that's quite a paradigm shift. And so I came to to the Franklin Pierce University hybrid program through a couple of means. One is that I did all of my interviewing online with them, but I also had the opportunity to present my vision to them and how I felt we could move forward with a program in Austin, Texas that would be great not only for the community but for Texas as a state, and how successful we could be in utilizing the hybrid platforms that there's so many available now, as you can imagine. That we could utilize those to really draw on a national approach to not only our admissions system, but also to deliver all sorts of training and learning in areas where you wouldn't normally do that if you had to be on campus 5 days a week, 8 hours, 8 or 10 hours a day. So that's kind of how I came upon Franklin Pierce. They certainly had the infrastructure to do those things, which captured my attention. And they had the same vision that I had about how we could really improve the lives of Texans through the delivery of outstanding PAs to the market. So,
well, it's nice to see that there are more of these hybrids. As having worked with students for almost 2 decades now, I come across many who it's just a geographic thing for them. I'd love to go to school, but non-traditional student, have maybe a family, children. I had a woman a couple of years ago, and there were only 2 programs that were near her, but still quite a distance for her to travel. And it's just not in the realm for her to leave her house or family and go away somewhere, where be it if there was something closer or online, it'd be a much better avenue for her. And seem to encounter this more and more. People just, whether they're limited, like I said, by other means, a family that they're raising or have. So it's nice to have these other opportunities that are available to these people that for otherwise would be great practitioners if they could get into a program that suited their lifestyle.
Right.
So one of the things I wanted to talk about, because we get this question a lot from students, is when they read about new program or developing program, they get a little skittish. And we always try to reemphasize that, medicine is not new. So, it's not a new subject we're teaching. And the faculty, generally speaking, and especially like in your case, they're not new to this either. So they've taught before. So if you could talk a little bit about a developing program.
Sure. And I think you're absolutely right. The ARCPA, which is our accrediting body, really has a well-established history of being very mindful of the care that we take of our students, as well as what we're delivering to the market, so that we can provide the best care to patients wherever that is. And the ARCPA has also created the guidelines and constantly reviews them, and they're very dedicated and committed to those standards. And as such, we as developing programs are very committed to those standards. We make sure or we ensure that we follow them, and not only follow them, but also assess them. So there's a very strong assessment component to that. Because I've had this conversation several times, and as a developer of PA programs, students or applicants, I should say, can be very skittish about it, but it is really how we script our delivery of that. And how I've gone about it with teams in the past is that we are constantly monitored. Every step that we take, we are monitored through those steps. Now we have a label that the RPA provides to us, so that whenever we communicate with an applicant or a student or another, or even preceptor, we have to let them know that yes, we are a developing program. We have achieved provisional accreditation. We'll go through several monitoring site visits, and this is our plan to make sure that if you join us, if you're offered a seat and you join us as a PA student, that we're looking out for your best interests and the best interest of the community. And a lot of that comes from the support of the institution, as well as the work that's being done, and the dedication and passion and commitment of the team. So I think, I know applicants, when they look at a program and they see that that the leadership is strong, that they're very committed and passionate. Most don't have an issue with it. With the university I was with, that's in Richardson, Texas, it was a 50 student cohort start. 24-month program. We had a very solid team. We had a solid provisional site visit as well as accreditation, minimal citations. And our admissions process worked very smoothly, and it was about as unbiased as we could possibly make it, so that we had a well-rounded cohort to start. And to the best of my knowledge, and what I've been told by some colleagues, is that all those students are doing very well at this point. So yes, there is some hesitancy. Most people would say, well, I'd like to go to this one or this one that's more established and has a track record. And I can't deny that. I can't say, well, wait a minute, we're going to be doing it better, because that's really talking about a school, and it's not being truthful. But we are under the same standards and guidelines that any other well-established PA program is going to be under. We're held to those same guidelines that they are, and we have to be committed and dedicated and passionate about what we do. So those are kind of the messaging. That's some of the messaging that I try best to provide to applicants as they look at different programs that they want to be a part of.
You mentioned the work involved. That's something else we always bring up, which is this isn't something somebody sitting around having coffee said, hey, let's start a PA program. This is
right.
It's when you reach the point where you're accepting applications, it's been years in the process. I don't know if you're aware, but in San Diego, I think it was in 2020, there was a couple who gave $7 million to UCSD to start a PA program. Just the PA program. So we always talk about the money, the time that's involved. This is not just something some people just on a whim said, hey, let's put this together. It's been years in the making, and a lot of money that's invested in getting to that point. So if they're accepting applications, it's solid.
Yeah, and it is. And they're, you're certainly right about the amount of time that goes into it. Just taking as an example, Franklin Pierce's program, we have a start date in March of 2024, and we're starting right now in March of 2022 development. So we didn't just spend a month or two throwing something together. It was well thought out. And of course, the financial impact of that for any university that's not going to get a return on investment, because that's what they'll look at least that's what the bean counters will look at. It takes 3 to 4 years of tuition income in order to meet that, zero, or to make it a zero sum or profitable. So it is a huge investment.
Yes.
And they're very mindful about it.
When do you anticipate starting to take applications for the first cohort?
The CASPA system is the one that notoriously used by just about every program, and we'll use it too because it's a great system. And that's just their computer admissions process, or computer admission system for PAs. They open at the end of April every year, and usually go through an entire 12-month cycle. We will probably open up our cycle in April 23. And of course, there's a lot of things that go into that in the preparation to make sure that when people get into the CASPA and they're able to pull down Franklin Pierce University in Texas, that they have all the information available to them as far as what the prerequisites are, what the expectations are, and so on.
What about some of the requirements? Is this going to be a master's level program?
Yes.
Okay. Do you know some things now? Do you know if you're going to be requiring the GRE or Casper testing?
I've avoided the GRE. And so as the program director of this program, I'm probably going to avoid the GRE. I don't see its impact. And it tends to be more of a barrier than it does any or a substantive effect on outcomes. And because it's very expensive and people have to study for it, and it really doesn't provide any guidance to us as a program to know whether or not that individual is going to do well through the PA program. So it's not likely I'm going to have the GRE as part of the admission process for our program. The other one, go ahead.
I'll say, we noticed last year towards the end of the cycle, some of the schools, some of the programs were actually asking students, just as a side question, what they thought about the GRE. And we've seen more and more programs over the years that we're doing this dropping it as a requirement. And I just, it feels like there's this trend too, because it is not a good indicator of what a student will do in the program. And although you and I, a little older school, so I remember calculating out doses of medications, even grinding up certain medications to make my own little IVs and trying to dose things out. I remember in a hospital one day trying to do this, and the doctor looked at me like, "What are you doing?" I was, I'm going to calculate out this dose. And he grabs the order sheet from me and he writes something on it. He goes, "Here." I looked and said, "Pharmacy to dose." He goes, "That's all you ever need to know." He goes, "Knock it off."
Hippocrates. Just put Hippocrates on
Well,
your phone.
right, but this was, again, before all of this digital.
Yeah,
So this was back in the day when, but right now everything is just online. And I tell students, really, if you can just, the only calculation you're probably ever going to do is just, okay, if you have 30 patients to see in a day and you've seen 5, how many more patients do you have left? That's about all you need to calculate. So, the quantitative on the GRE is, I just think, yeah, it's not a good indicator of how. I've seen students, I've had students at 3.8s, 3.9s, excel in all their sciences, but just have trouble with the GRE. And it's just not a good indicator of what they'll do in a program.
I take more of a holistic approach to it, and I've had some success with that. And really, what I did was I weighted those non-academic indicators higher than the academic indicators, and by that I mean, you had mentioned Casper as one of the tests. Now that's a situational judgment test that's actually really bubbled to the top quite quickly, not only across medical schools, but in PA programs. And, and so what I've done is I've integrated that, because really the cost to the student is relatively low. I think it's about,
right,
$40 or something to take it.
Right.
And yet it has the ability to really weed out or weed in, if you will, those individuals that have the compassion, the grit, all the things that we're looking for, that when you're running a student through a 24-month program where they're basically getting 4 years of medical school in 2 years, they've got to have the passion and commitment and grit to do that. It doesn't matter how smart they are. Smart is important, but it's not, this is not undergraduate work.
Right.
This is not at your own pace. This is at our pace. And in order to get you trained so that you could be an incredible clinician, that you got to have the passion and the grit to get through it. And so I found that if we focus on those things that really, and just a little side note, when a physician goes through medical school, they have to be incredibly intelligent, and they do, and they are. But if they're not great people, they have options. People with questionable personality issues, they have opportunities outside of direct patient care.
Right.
And I don't say that to be mean. I think it's true.
Yes.
Where in PA training and PA programs, you're going to have interactions with patients. And if we don't understand how our personalities affect patient care, we may be doing something wrong in our PA students. So my focus, and I think it's a focus of many programs, is to ensure that we're developing good people, smart people, but good people too.
Well, you brought up the fact about, it's 4 years of medical school into 2 years. And this is something that we try to express to our candidates when they talk about attending, that, what you're getting into. When I went to school, we were in the classrooms with the med students, and just, it's no different. It's just, I talked to the doctor I work with yesterday, and he's talking about when he went to medical school and he took his anatomy and he took his physiology, and said, right, just PAs do that before they get into school. So the actual schooling itself, the doctor isn't teaching bronchitis or diabetes care any differently doing the med student. So it's all the same intensity.
Right.
Okay. So how about, just wanted to know, I guess, like the clinical rotations, so since the student is attending online for their didactic portion, I'm assuming that clinicals probably be able to be performed locally or where they're located?
Yeah, that's the idea, is that, the accreditor is very strict on how we can approach or we do not want our students to be, what's the right word, actively pursuing these clinical rotations. That's something that we need to do as a program. Now we can take suggestions, and which we will do, but at the same time, these rotations will be something that's driven by the program, because there are learning outcomes that are expected. There's evaluation processes in there. These are actual courses that the students are taking for their immersive learning, which is being immersed into the clinic. So there's certain things they have to hit for each of these rotations. It's vital to us as a program as well as for their learning, so that we can adequately assess them. But yes, that is true that a lot of these sites will be in close proximity to the students. And I think that that's a great opportunity for a couple of reasons. One, I think, we have, if we're talking about making sure that we cover the disparities in Texas, disparities of care in Texas, the limited care availability and access in Texas, then we have to allow our students to learn in the same environment in areas in which they're going to be practicing likely. And so this gives us a great opportunity for an online student to be placed in a family medicine rotation that is in their community. And as long as they meet what the program's expectations are for that rotation and able to assess the student appropriately, well, then that's a great opportunity for that student. They can spend so much learning and integrating into the community already. And then we have done our job as a program dedicated to making sure that our communities have access to care. We're able to do that, and we can prove it and we can show it. And the students and the community get the same benefit. So yes, there'll be availabilities primarily for these students to do their rotations locally, which means that we'll have a lot of different rotations across the United States. And I'm excited about that. I've done it also where we had to have a lot of things done locally and here in the DFW market. But we also had rotations down in Bryan College Station. We had rotations up in Illinois. We had them out in California. And so they weren't just, every single one was not here in the DFW area, but many of it was. Many of them were, I'm sorry. And I thought that would help benefit this community, this city very well. But at the same time, maybe it left a little something to be desired around these local and these areas that have less access to care.
Nice. I like that you mentioned, how the schools certainly do bear responsibility for this, because this always comes up when we talk to students about the fear of having to find these rotations. Let them know, the school, certainly if you, as you mentioned, if you had suggestions, they're open to that, but the school certainly isn't leaving the onus on the student. The school is responsible for the student in terms of what they're learning. So
no PA program can do that.
Right. We try to tell them, because they get this fearful, hey, I was told, like, trust me, they have to do it. Okay.
Yeah, we have to do it. And we want to do it because
right.
We want to have some continuity of how these students are learning.
Right.
Because that's because it has to meet our mission. And so our mission and our goals. So we want to have that, not that control, but we want to be able to say, this is a great rotation that's going to deliver the practitioner that we're expecting to deliver to the market.
I know you mentioned earlier about a holistic approach, and this is something also we've seen this trend where more and more in schools. So one of it comes up with, sometimes there are students that really are exceptional candidates. They just, maybe in their first 2 years of college, they didn't know what they were going to do and didn't do well, but over their last 2 years. So some schools will take into account a student's last 60 credits. I don't know if this falls into your holistic approach or not.
I didn't look specifically at like the last 60 hours. What I did instead was, when we looked at our overall rubric for the admissions process, we broke it up into really 3 sections. One was the academic section. And that one, I lowered it to 2.7 for overall GPA in an undergraduate degree, but 3.0 for your science acumen, and which is relatively low compared to other programs that may come in a little higher. So I weighted that at about 40% of the overall admissions package. The other part of it, the 50% of it, was the non-academic. And the non-academic included review of essays, recommendation letters, the Casper, which is a Z-score that's provided. For those in statistics, a Z-score is just one way of putting things into a bell-shaped curve. Mm-hmm. And the other one was Snapshot. Now, Snapshot is part of the Altus assessment group. And what it is it's 3 questions that they ask mm-hmm. of an applicant on the fly, meaning they have no preparation for it and they have 3 minutes to answer it. You may be familiar with it.
Yes.
And so we use that also, and we had reviewers for those that were trained to review those. And the last part of that non-academic was the interview. And so the interview was 2 interviewers, 1 interviewee, blinded, meaning that the interviewers have had no knowledge of the applicant. We had enough players and members, if you will, in the committee that we could really divide this up well. So the 2 interviews had no prior knowledge of the applicant, so they went in blinded, and the questions were very structured, and they met our goals. And so we had response expectations according. So if an applicant said this, they were given a point for it, but we didn't tell them what those were. Those were behind the scenes, but we had structured expectations. So there was really very little room, in fact, almost no room for, well, I kind of think I wanted to remove that. And that was one way that we could remove those biases from the interview process. And so the last part was that little 10% was experience. And most of our applicants had lots of experience. I think most applicants come to these programs with some military experience or other healthcare experience. And so I found that most of our applicants had tons of experience. And so bringing all that together, I felt like was a good way to look at applicants to make sure that they could hit the benchmarks from an academic standpoint, mm-hmm. but more importantly, did they have that commitment, passion, and grit that it takes to make it through a program? Can they adjust on the fly when they're getting pummeled by work? And that really, to me, was more important than somebody who was a 3.9.
Right. Well, this is what we emphasize a lot in the interview part of it. Just, this is what you're going to encounter in real life. You're going to go in, maybe it's in the office clinic, and all of a sudden, here's the diagnosis. You've got to give it to the family, the parents, the patient. And then all of a sudden they have questions that you had no idea they were going to ask. Or maybe you're in the ER and somebody just had a stroke, and the family wants to keep them on life support. Somebody else wants to let them go. And there's a question about advance directive, and just a lot of things you're not prepared for. And you have to be able to answer these things, as you say, on the fly. It's just things you just can't imagine you're not ready for. And can you do that?
No, you're absolutely right. You're absolutely right about that. And patient experience is so important now.
Yes.
Listen, we, being a director of advanced practice clinicians for a while, I mean, that I was having to follow PAs and NPs around to make sure that they were to observe them mm-hmm. on how they interact with patients, and you really get some eye-opening experiences there. Some really great experiences. Some you're like, oh my gosh, I can't believe that's the way you communicate.
Right.
And so, it's a great way to figure out, are we really treating patients with the dignity and,
mm-hmm. yes,
and compassion that we're supposed to. And so patient experience, and when they're scored on it, I mean, clinicians are scored on that, and sometimes it affects their bottom line, and it affects mm-hmm. their paycheck. So if I'm not training, or my team's not training our students to understand the patient experience expectations, then I mean, I'm not really giving that student really what they need to get into practice.
Right. Okay, so for any future students who are considering your program, I know Franklin Pierce has a website already, but I guess, will it be the same information that'll be for the program, the upcoming program in Texas, or will there be a separate website?
There'll be a separate website. These are 3 distinct programs. The ARCPA, our accreditor, says, hey, if you're going to have 3 programs, they need to be distinct programs, which means we'll have our own mission, vision, and goals. We'll have a curriculum that's probably pretty similar, just because they're doing such great work. It'd be, I don't like to reinvent too many wheels if I don't have to.
Right.
But at the same time, there are expectations in the Texas market that are going to be different from the Arizona market, from the New Hampshire market. And I want to make sure that I approach those, even though we are a online program, likely that a lot of Texas individuals are going to want to come to this particular program.
Yes.
So we'll want to pay attention to that. But yes, it will be a distinct website, probably pretty similar in style. Content will be different, but the style and layout is likely to be pretty similar across all 3.
Do you have any expected time when you might have something online for students to research a little bit more about the program?
Usually we have to wait until, and this is not uncommon, some programs don't, but ours will. You wait until you get that provisional approval before you put something structured up into the public.
Right.
Now the accreditor will ask for that. They always do. They want to know where you're, what's your public face of this program. And so we have to be mindful of that. But at the same time, I don't think that we can display something specific until we get our provisional accreditation.
Got it. Is there a time scheduled for that meeting or for that decision?
There is. We have a site visit in June of 23. And usually when you have it in a June month, usually have to wait till September for the board to meet. So sometime in September, October, we would get our provisional accreditation.
Great. Okay. Well, I really appreciate you doing this and taking the time to talk to us today. This is great information. And again, it's nice to catch up with you again. It's been many years talking over the phone. So
way too long.
Yeah.
Way too long. Hope to see more.
Yeah. Well, congratulations on everything that you've been doing. And truly is amazing, to see somebody who's quite a career as a clinician and then into academia and now forming a program, and who knows after that. But
yeah, who knows. Who knows, but I'm excited for the future of PA education.
Well, again, thanks very much for your time, and I look forward to this program opening. Sure you'll have no shortage of qualified applicants.
Thank you so much, James. I greatly appreciate it.
Thank you.